you who don't know what Parkinson's disease is, what are its early signs and symptoms, what causes it, and how many people are affected by it in India. Now, to answer these questions and more, we have two guests joining us today. Dr. Atul Prasad, Principal Director and HOD Neurology at BLK Max Super Specialty Hospital, and Dr. Prashant LK, Consultant Parkinson's Disease and Movement at Manipal Hospitals. Now, thank you for joining us, doctors. Thank you for taking out time to do this. Now, let's start off and get into the thick of things. And let me address my very first question to Dr. Prasad. Dr. Prasad, how would you define Parkinson's disease? And, what are its demographics in terms of, age, group, gender, region? Are there any differentiators to people with people who have Parkinson's disease?
Okay, so good morning and thank you for inviting me. Parkinson's disease is a neurological disease. It's a progressive disease. It's a disease where certain areas of the brain degenerate this premature aging, and they die off. And when they die off, the function which they serve becomes less, and the patient becomes symptomatic. Usually, they present with the symptoms of Parkinson's disease is difficulty in carrying out the day-to-day activity. They become slow. They may become stooped. They may develop tremors. They may develop shaking of the hands and legs. They may develop falls. So these are the three or four important symptoms: lack of poor balance, poor in balancing themselves, tremors or shaking of the hands and legs, and bradykinesia or slowness. So they may develop different combinations of this, which starts interfering with their activities of daily living. Usually, idiopathic Parkinson's disease is a disease of the elderly. It occurs in more than 60 years of age. And in India, the prevalence is about 1 to 2%. So as we age, there's more chances of developing the disease. It can occur in the younger population also. And when it occurs in the younger population, there is usually some kind of a genetic basis to it. They are predetermined, or they have a genetic abnormality which predisposes to Parkinson's in the people who are younger than 60 years of age. So this is what I want to say.
Are there any differentiator in terms of gender or region in India? Like more women get it, more men get it?
So what we have seen is that more men get it as compared to women, but I think after a certain age, it doesn't really matter whether you're a male or a female. Anybody can get it.
Right. Dr. Prashant, let me come to you now. What are the factors that contribute to the occurrence of Parkinson's disease? And does external factors such as lifestyle choices, pollution, etc., worsen the condition?
Look, when we talk about Parkinson's disease, primarily we talk Parkinson like as a sporadic disorder. Sporadic means no one else is affected, and someone is getting affected newly, means none in the family is getting affected, or none in the known vicinity set of people are getting affected. So this is how we thought about Parkinson's disease when it started initially. Down the time, we have understood a lot of things. We know that genetic forms of Parkinson's disease are well established and they are well known. Even though most of the understanding about Parkinson's disease we get from these genetic forms of Parkinson's disease, they contribute only about 5 to 10% of the patients, whole when you look into the Parkinson's disease cohort. So there are about another 90% of the patients, we don't know how they are acting. So there are various factors which we look into it, what we call it as in medical terminologies as genetics and epigenetics phenomena. Genetics is what you are born with and what type of genes you are having it, and how those genes are predisposed to develop certain type of issues. For example, if you are a person having in your family, you have having genes for developing hypertension or diabetes, if you don't maintain a good healthy lifestyle, probably you will develop this diabetes and hypertension earlier in the life, as against to 40s or 50s in other set of family members. You may develop in 20s or 30s itself. That's also a feasibility, right? So
I think Dr. Prashant is having some um, problem with the connection. Dr. Prasad, am I the only one?
I can hear you. We can hear you. We will not hear. I
So
think
Dr.
Prashant is
Prashant has a
maybe is
network issue.
Decides how the things will go on for it. And to genes, there are a lot of what we call it as contribute to the occurrence of Parkinson.
I think he will join back. He has joined back. Dr. Prashant, we had lost you while you were talking about genetics and epigenetics. Can you please
Yes, I think
start
I
off
got
from
some
there?
of it. Fine. So the point is, what happens is there are various chemicals what we get exposed to. For example, in a day-to-day practice, the fungicides or pesticides or agricultural chemicals what we use it. Many people who are consistently or regularly being exposed to these things, they may be having a higher risk of occurrence of Parkinson's disease. It could be that they are more sensitive or they may be having certain genes. And in addition, exposure to these things can increase the threshold for occurrence of Parkinson's disease in certain subset of populations. So these are considered potentially chemical exposures. In addition to these chemical exposures, there are certain things which can increase the occurrence of Parkinson's disease. For example, poor lifestyle, obesity, increased carbohydrate intake, increased fat intake, people who have increased total caloric intakes with carbohydrates and fats are likely to have higher risk of occurrence of Parkinson's disease. Whereas there are certain factors which we call it as protective. Protective means the chances of occurrence of Parkinson's disease reduces. Easiest is to telling that surprisingly smoking, increased coffee intake or caffeine intake in a realistic terms to tell that they are considered to be a slightly protective for occurrence of Parkinson's disease. In day-to-day practice, over a period of time, what we have seen is there are a lot of external factors which do play a role, and these external factors work on your own gene pools what you have, and based upon those gene pools there is more likely chance that whether you develop a Parkinson's disease or you don't develop a Parkinson's disease as such. I think probably that should answer your question down there.
Right. Yes. Thank you. Dr. Prasad, what are the early signs of Parkinson's disease that must not be ignored? And how can one differentiate between the signs of Parkinson's disease and the age-related slowing down symptoms?
Okay, so there are two important early signs which we should be on the lookout for. One is the shaking of the limbs, that is called tremors. And second is slowness or bradykinesia, when the patient becomes slow in carrying out the day-to-day activities. Now, number one, the tremors. First thing is that all tremors or all shaking is not Parkinson's disease. It's not Parkinson's disease. There are various causes of tremors or shaking, and one of them is Parkinson's disease. The classical Parkinson's disease is when you have tremors at rest. That means when you're resting, when you're relaxing, and then the hands start shaking. That may be an early sign of Parkinson's disease. It should not be ignored, and it should be followed up with a neurologist. Second is bradykinesia or slowness, and this usually manifests in patients' day-to-day activities. For example, change in handwriting. The words become small, the signature changes. Patients start taking more time in eating, in dressing, in the toilet as compared to before. They can do all the activities. They do not have weakness, but it's just that they take more time. So two things, a patient is taking more time if patient is more than 60 and patient starts taking more time in carrying out the day-to-day activity, the handwriting changes, the words become smaller, and if they have some kind of a shaking, it's a red flag for the patients, for people, for the family to consult a caregiver, health caregiver, preferably a neurologist, to make sure it is Parkinson and nothing else. Now, again, like I said, there are many causes of tremors, and all of them are not Parkinson's disease. So don't panic, but do get yourself checked up if you have shaking or tremors, and especially if along with that the handwriting has changed or you start taking more time in carrying out the day-to-day activities. The third Parkinson symptom of falls, the lack of balance, is a sure giveaway. If a person starts falling, it's not normal. It's not normal. It cannot be part of aging, and they should definitely get themselves checked up whether they are falling because of a cardiac issue or because of a neurological issue.
Right. So there's a deconnection between the motor skills and the cognitive ability, and these normal tasks when you are having difficulty in just carrying out these, then that might be a possible sign for Parkinson's disease, but not only Parkinson's disease. That could be,
Be
for
not Parkinson, better to have yourself examined.
right, right. So yeah, again, people also tend to perceive Alzheimer's disease and PD as same, Parkinson's disease as same. How can we distinguish between the two? Dr. Prasad, can you answer that too?
So Alzheimer's disease is basically a dementia where the patient starts forgetting things. It's a cognitive problem. It's a problem of not so much of motor skills, but of thinking, of planning, of calculation, of memory. So Alzheimer's disease is a dementia. So the initial presentation is one of forgetting things and carrying out planned activity. Uh, Patients of Parkinson's disease can develop dementia later on, but it does not start off as dementia. It usually starts off as motor skills, as shaking or difficulty in writing. So both of them are degenerative diseases of the brain. However, depending on where the degeneration starts, patient can develop Parkinson or they can develop Alzheimer's dementia. Very specific location in Parkinson's disease, part of brain called substantia nigra, which starts degenerating. Very, very specific. That does not really cause the cognitive or thinking problems till much later on, much later on.
Dr. Prashant, what are the different stages of Parkinson's disease?
Look, Parkinson's disease is a slowly occurring, what you call it as neurodegenerative disorder. So it's as simple as telling a aging process. When we look into aging process, degenerative stages, what is happening? Many symptoms are there, but at one point of time, we start to naming those diseases as a disease. So Parkinson's disease, when you look into it, we call it as Parkinson's disease when people start developing certain set of symptoms. In medical terminologies, we call them as trap features. Like person may have T, trap is for T for tremors, R for rigidity or stiffness like sensation, A for akinesia or slowness like symptoms, P for postural instability or balance related issues. So any person who develops features of trap features, we tell them that they are having possible diagnosis of Parkinson's disease. Albeit, people can have symptoms of Parkinson's disease prior to this. So when people have symptoms prior to this, which were not diagnosed or not recognized, like Dr. Atul was telling that there are certain set of symptoms are there, which are well acknowledged before the diagnosis of Parkinson's disease is done. So these set of symptoms, what we call it as prodromal symptoms, means these symptoms were there ahead of time, but we were not convincingly able to label them with Parkinson's disease. But when these other set of symptoms, they finally develop, then you call it as Parkinson's disease. Like you have a fever, it was fever, we don't know what was the reason for fever. Then down the time you have fever with cough, you know it as a chest infection, right? So that is how we narrow it down. So people can have various prodromal symptoms, such as loss of smell, sleep-related issues, means talking in the sleep, yelling in the sleep, constipation type of symptoms, means they don't have regular bowel movements going on, mood changes can be there as a lot of prodromal symptoms in a lot of patients with Parkinson's disease initially. But once they move from the prodromal to the initial Parkinson's disease phase, that is stage 1, you can take it as in a simple way, the stage 1, or what we can call it as stage 1 as a diagnostic phase also. This is the phase when people have certain mild symptoms are there. They are worried about those symptoms, because they have a mild tremors, mild stiffness is there. This is not bothering, this is not interfering in their day-to-day activities, but they are concerned about those set of symptoms. So this is called as a diagnostic phase, mainly because at this phase of the life, patients or family members of the patients take people to various doctors. They're not convinced that, oh, I don't know, I went to a doctor, they told me I have a Parkinson's disease. I don't have any problem. He didn't even check me out. By the time I sat on the chair, they told I have Parkinson's disease. So this is what happens. So this phase usually lasts for about a year or two, wherein people will have subtle symptoms are there, which are easily recognizable, and people are more concerned about it. Down the time, what we have is we go from a diagnostic phase to a maintenance phase, what we call it as. In this maintenance phase, what happens now, people accept it, they have Parkinson's disease, And they know that when they take medication, they have a decent, good improvement is there in their quality of life, means they're able to manage, their stiffness reduces, they're able to do their work as professionally as possible. And this, what we call it as maintenance phase, lasts for about next 2 to 5 years or 2 to 6 years, based upon patient to patient, and other external factors do decide on those things. Then, followed by this, then what people will start having is erratic responses to medications. Erratic responses means either they have too much effect with medications or too little effect with medications. So we call this as motor complications phase, wherein people are getting good response with therapies, but to get a decent improvement, a stable improvement, they need to take medications more frequently. Erratically responses are there. And this phase lasts for next about 5 to 10 years, another 5 to 10 years, what you should keep in mind. Then followed by that, people will start developing symptoms which are not primarily related to dopamine deficiency. In Parkinson's disease, when we talk about, everyone knows that it is related to dopamine chemical, which is getting lost in Parkinson's disease, and that causes Parkinsonism. But however, there are other chemicals are also getting affected in Parkinson's disease patients. Hence, down the time, they develop other set of issues, like, for example, memory issues, balance issues, bladder control, behavioral changes. We classify them as non-dopa responsive symptoms. These are symptoms which are not going to be responded with regular dopaminergic therapies. And this is the phase, what we call it as advanced Parkinson's disease phase, where more and more supportive care, palliative care comes into role, which lasts for another few years, let us say 3 to 5 years or 3 to 8 years in the lifespan. This is how a patient with a Parkinson's disease moves from a prodromal phase, wherein you don't have a diagnosis of Parkinson's disease, to an early diagnostic phase, which lasts for about 1 to 2 years. Then you have a early maintenance period, which lasts for about 3 to 6 years. Then you have motor complications phase, wherein you still have a good therapy, which lasts for about 5 to 10 years. Then you have advanced stages of Parkinson's disease. I think that should give a gross overview of the understanding of Parkinson's.
Right. So, you've defined all these stages. What are the kind of care that is given to a patient? How do you ensure emotional support to the Parkinson's disease patients and counsel them as well as their caregivers?
See, the point when we talk about patients, many times patients come to us with a panicky state, telling that I have been diagnosed to have Parkinson's disease. So this panicky stage this is what they come with us. They are worried that something has happened to them, a disease which they have never heard about. This is their end of their life, or they would have gone and seen on Google to see some end stage Parkinson's disease. And that is where they feel that, oh my goodness, my life is done. I can't do anything. This is the end of my life. And this is where whole myth about Parkinson's disease is related. Most of our time, because that is when we saw that early diagnostic phase or in the early maintenance phase, when they come to us, they are very anxious about their diagnosis. The whole goal is to tell that anxiety is really not required as such. Unlike many other disorders, what we look into it, Parkinson's disease is some disease where very good treatment options are available. Many times when I speak to people with Parkinson's disease, when they come to with so much of anxiety, they're told that I have Parkinson's disease. I know that's where their anxiety is located. So the point, what I try to highlight is, this is some disease where good treatment options are available and you need to have a good, better quality of life. Usually I take examples of diabetes and hypertension to compare with Parkinson's disease, mainly because that people commonly accept diabetes and hypertension. However, if you know that people with diabetes and hypertension, whenever we diagnose them, even though they may not be having any symptoms externally to see it, if they have symptoms, if they have increased blood sugars, if they have increased blood pressure, we need to treat them. The goal of the treatment is to make sure that other, what you call it as end organ damage, the further complications what they cause down the time, to reduce it. So there you don't have much option. You need to take the treatment. In spite of taking those treatment also, down the course, your medications are going to increase and you may end up having a complication like diabetes. People will develop diabetic nephropathy, retinopathy, or cardiac issues. They can develop with that in spite of doing all those things. But Parkinson's disease is not like that. Parkinson's disease is something to be happy about. You have problem, it doesn't mean that as soon as you have symptoms, I need to treat you. And if you have symptoms, we have treatment options. No one is going to tell you that, oh, 2 years back, if you had taken that treatment, now you wouldn't have developed like this. Parkinson's disease, in a realistic term, I usually use an alibi of graying of hair. You have a gray hair, everyone is able to see it. It doesn't mean that as soon as you see it, it doesn't need to be colored also as such. It's more of anxiety for you that you have the gray hair. It doesn't mean that it has to be treated. But you have good options are available, which can make your quality of life better. You can make better, and you have better quality of life. So many times when you counsel them about this, you give empathetically discussion about their problems, and that helps to reassure them a lot, and that helps to have a better quality of life.
Right. Dr. Prasad, let me come back to you. What is the lifespan of persons suffering from Parkinson's disease, and can this be increased by treatments or lifestyle changes?
Okay, so this is very important. Parkinson's disease itself does not kill a person. It's the complications which occur in patients with advanced Parkinson's disease which can kill a person. The disease itself is more crippling rather than killing a person. Now, second fact which we should understand and pass on to the listeners is that Parkinson's disease behaves differently in different patients. It's not that all of them will follow the path which Prashant has so nicely elucidated, that going on from the prodrome to the obvious phase, to the complication phase, to the non-motor symptoms phase. So important, how it's going to behave is difficult to say on day one. Over a period of time, the neurologist will be able to tell whether it's going to be a bad Parkinson or it's not going to be a bad Parkinson. And Parkinson does not kill a person. Most of the motor complications of Parkinson can be treated by the expert with the help of medical treatment or with some kind of a surgical intervention, which can help these patients. When they start going in for the non-motor symptoms, when they start developing cognitive impairment, dementia, that is the period when the lifespan usually gets reduced, because as the dementia progresses and the patient loses the ability for self-care, then they're more prone to develop infections, which can lead on to death. And that is what we are trying to avoid in our patients of Parkinson's disease. So to answer your question, how it's going to behave from day one is difficult to say. Second is the disease itself does not kill, it's the complications. So if you're under the care of a specialist and if the disease is under control, the chances are that the patient will have a normal lifespan as compared to anybody else of a comparable age.
Right, that's great. So it's so the symptom, the effect or the symptoms might not go. So there is no particular cure for it, but you can live a normal life with the medications, with the treatments which is available currently.
Yes, I think that's a very important message which you should go on to the non-doctor or the audience, that we should not have any disease, of course. But if you have to have a disease, Parkinson's disease is a treatable degenerative disease. And it's either should not have it, or as compared to Alzheimer's or other kinds of degenerative disease, Parkinson's disease is to a large extent treatable with the almost normal lifespan if treated properly and with interventions taken on time.
Yeah, can you talk about these interventions which can make a person lead healthy and normal and longer life while dealing with Parkinson's disease? So can you elaborate?
The treatment will be pharmacological, surgical, and of course lifestyle change. When Prashant was talking about the causes for Parkinson's disease, in my opinion, lifestyle change is very important. Lifestyle change is important. Lifestyle problem is important not only for Parkinson but for any degenerative or any part of the degenerative disease of the brain. If you eat healthy, sleep healthy, and live a healthy life, maybe away from pollution, maybe away from pesticides, the chances of your brain prematurely aging becomes much less. So a lifestyle change is important for all the patients. They should be as active as possible, as mobile as possible. They must go for a walk every day, practice yoga every day, and eat healthy. The second part is the pharmacological treatment, and we have a variety of pharmacological drugs for patients of Parkinson. The doctor may choose one over the other, but sooner or later, the patient would be on dopamine replacement treatment in the form of tablets of levodopa, which gets converted into dopamine in the brain, the primary chemical which is reduced in the Parkinson's disease. The dosing, the timing, how frequently it has to be given, the different formulations which are available, the doctor, the neurologist guides. The choices are many: how to give, when to give, in what formulation to give of this dopamine replacement treatment. Sooner or later, a stage comes, as Prashant said, when the patient starts developing fluctuations, dyskinesias, or a problem of too much of dopamine in the brain, alternating with too low dopamine in the brain. And those are known as the complications, motor complications of dopamine therapy. And that is a stage when we offer the patients an option of some kind of surgical intervention known as deep brain stimulation, which is similar to what they do in the heart. They put a pacemaker in the brain. Just like they put a pacemaker in the heart, we can put a pacemaker in the brain, and we can electrically stimulate the brain. We do not damage, we do not cut any part of the brain. We don't throw away any part of the brain. We just put small electrodes, leads in the brain, and we give small amounts of electrical currents in the brain, which to a large extent benefits patients of advanced Parkinson's disease. So
Right.
pharmacological management, surgical intervention in the form of neurostimulation, for deep brain stimulation. And I always tell my patients about lifestyle change: be as active as possible.
Right, right. So, are there any do's and don'ts when, a person is going through the stages of Parkinson's disease? Dr. Prasad said that it depends person to person, and all the stages might not be occurring in a particular person. But when we talk about when a person is going through these motor skill issues, so are there any do's and don'ts for them? Are there any activities which might help them, bettering their motor skills, or are there any activities that they should avoid at that point in time, Dr. Prasad?
Okay. So what is you again? Be as active as possible, but there will come a time when the falls become an issue. Now, falls are bad. Falls is always bad, and when the patient falls, there's a high risk of fractures. There's a high risk of injuring oneself, and that is a time when we need to modify the house. We need to send a physiotherapist or occupational therapist to the house to modify the house, especially the toilets. Especially the toilets. Now, toilets are the areas where maximum falls occur in the Indian population, for the simple reason because they usually are wet. So usually I tell them that if possible, the toilet for the patient should be reserved for the patient and should not be used by other people. We advise them on putting those iron or steel rods in the toilet so the patient can hold on to and should not fall. Especially the iron rods next to the toilet seat and next to the basin. The areas, whenever they wash their face, that's the time when they close the eyes, the visual input decreases and the patient is prone to fall. Falls should be avoided at all cost. At all costs, falls should be avoided, and some kind of mechanical help in the form of iron bars or rods in the toilet, even in the rooms at house, should be strategically placed so that patient can hold on to and does not fall. Physical
Right.
activity, walking is very important. Cycling, the people who are so paralyzed they can hardly move, but they can cycle. Cycling is, if possible, they can have a stationary cycle at home which they can practice on, or even outside if it's a safe place for them to cycle. So physical activity, be as physically active as possible. Avoid falls at all cost.
Right.
Strategically place furniture to hold on to in case not to fall.
Right. Right. Dr. Prashant, would you like to add to that?
Atul has covered up everything. The whole goal of treatment for Parkinson's disease is to lead a normal quality of life. Okay, so we want whatever people were doing at each phase of the life, try to maintain it as much as possible without major restrictions to begin with. So whole our goal of therapy, treatment, sessions goes into that. And during the initial phases, we exhaustively or we keep on pushing people to increase their social lifestyle, what you call group therapy sessions, talking to people, getting more involved in activities. Because motor means by movement wise, you are becoming more slower and slower with time. So we need to have something to keep yourself active. So by pushing you people into getting into more activities, more physical activities does help you out. So most of the things are do's. Do will be there in the list. Do this. Some people will tell that, no, sir, we don't do like that. He's always been like that. Not acceptable. You need to do it. So that is what we need to push into it. Don'ts are very few. Those are usually patient specific based upon the critical symptom what they're having or critical issue what they're having to therapists. And those usually will be discussed by your treating doctor whether there is something don'ts are there for you to work around that. But most of the things what we work around is for pushing people as active as possible to lead their lifestyle, whatever the best way they could have done it. And yes, in the later phases, there are various other things which are required, which Dr. Atul has already discussed about that.
Right. But Dr. Prashant, if we talk about palliative care and or end of life care at advanced stages of PD, what are the major decisions that the patients or their caregivers have to take while the treatments are going on?
Look, palliative care or end of life decision making when it comes out, this is a concept. Many times we are much more worried about palliative care or end of life decision making in a younger set of people, those who are not having aging related disorder. Like for example, person develops a cancer at the age of 40s or 50s, early 50s, where you are not planned for that. And there it becomes suddenly accepted, which is not, people are not planned for that. And we needed to sit and talk to them in detail about why it is required, why it is important to adjust those things, and why you need to start planning for your financial planning, will making planning, and all those things. But when you look into Parkinson's disease is an aging-related disorder. As we always get, it's a classical aging-related disorder, and it is the second most commonest aging-related disorder, only following Alzheimer's dementia. So this is what happens to everyone when we start aging, when we go from 50s to 60s, 60s to 70s, 70s to 80s, and 80s to 90s, there. So when these changes starts happening, these changes are happening over years and years and years. And with this time, and even with the age of that, what is going into it, people start planning. You start sensitizing them. There is no need to have aggressive push on the end of life decision making or aggressive life or palliative care. Even though the palliative care decision comes only in the last few years of your life, you start talking to them from the early phases. For example, if they are a professional or a businessman, to see whether they have a hierarchy system who is going to take care of their business as time goes by, or a family of retired family is there to see that whether financial planning has been done or a will making has been done. This can be slowly sensitized down the time, or modifications into the house, what is required, or supporting the spouse or the caregiver. Many times what we miss out in the development of aging related disorders or Parkinson's disease in specific case, caregiver burnout. It is one of the most important aspect which I speak to people is about caregiver burden, how the spouse is taken care of, or whoever is the primary care burden who is looking into it, how to manage those things. So we spend time on caregiver burnout, how to manage that, how people have to slowly transit from their professional life to a retired life, or people who are in retired life, how to manage their financial planning, or how to make a decisions of will making, or as and when things go on. Unless until there is a pressing need for us to do something emergency, these are taken over months and years on slowly sensitizing the patient and family so that they feel comfortable and accept these end of life decisions as such.
Right, right.
Shivam, can I add something?
Sure.
Shivam, I wish you hadn't asked that last question. There's no such thing as end of life care, palliative care for Parkinson patient. Now remember that Parkinson patient, only 1/3, 30% will develop dementia. that means 70% will not develop dementia. Okay, so we should not try to talk to them about
Yeah,
about
100%. I was getting to my next question, which was
the
about asking that what are we seeing in India in terms of how many people get treated and how many people get to the palliative care or advanced stage. So can you might want to take that, and
that is
what are the imperatives for what are the imperatives in that area to ensure that more people are ending on the positive side of it.
so if we understand that it's a degeneration of the brain, and as we age, some of us will get Parkinson disease. So and if in India, as the population ages and the lifespan increases, the burden of the disease will only keep on increasing. Okay, so again, with the in continuity of the last question which you asked and my answer, we should encourage people to understand that it's a disease. It can be treated, it can be controlled, maybe not cured, but it can be controlled. And with the proper care, the patient is independent, is continues to be independent for a long period of time. What Prashant said is correct. We encourage them to do more do's rather than don'ts. Okay, so and like I said, only about a third of them will develop cognitive deficit, and that is a time when, of course, the burden shifts from the patient to the patient's caregivers, and then we talk of writing a will and how they want to be managed later on. But most of them hopefully will never reach that stage, and they'll continue to be productive and take care of the family and the kids for a long time with proper medical care. Okay. So to answer your question, the burden will increase. Understand that anything which is out of the ordinary, shaking of the limbs, difficulty in carrying out day-to-day activities, handwriting which has changed, you take more time to wear your pajamas. Initially, you could stand and wear your pajamas and trousers. Now you have to sit because you lose your balance. There's more stiffness of one hand or of the body. That's a time to see a specialist, have it diagnosed. If it's diagnosed early, treated properly, the quality of life is as good as anybody with a comparable age.
Right. So getting diagnosed early is also very important in Parkinson's disease. That it?
We can offer them better quality of life. That's correct.
Right. Right. So largely with pharmacological interventions, lifestyle changes, and so some surgical interventions, 70% of the population who have Parkinson's disease end up on the positive side of it, which is leading a normal life with the medications and with the lifestyle changes as as normal people are in India. Right. Coming to my last question, it is the message for World Parkinson's Disease Awareness Day. I want to take that from each of you. Let me start with Dr. Prashant first.
Said Prashant or Prasad?
Look, I
said
think Parkinson's disease.
Prashant, go ahead.
Yeah, sorry. Okay. Look, Parkinson's disease is a treatable disorder. People have to recognize it's not a stigma, and good treatment options are available. We need to create more awareness, acceptance. More acceptance lead to easy treatment options, and people accept it and can have a normal quality of life, normal lifespan with that. Let us, this time, the theme has been let's create the spark, or let spread the spark of Parkinson's disease, or create the awareness of Parkinson's disease, which has been this year's theme, which has been working on for World PD Day is going on. So our goal is to increase the awareness and create more spark of awareness of people to understand about that. I think that should answer your question. Thank you.
Right, right. Just one more little question. You talked about the developing treatments. Are there any treatments or which are in the pipeline or in the rest of the world or in India which are which are yet developing for Parkinson's disease? Or
yeah. Look, when it comes to the treatment of Parkinson's disease, we are in the phase, what we call is now we are in the phase of symptomatic therapy. Symptomatic therapy means whatever symptoms are there, we are trying to treat that. And we are not trying to cure Parkinson's disease as of now. So all these dopamine or some of the injections or the DBS surgery, what we do, or different surgical therapies we do, these are all there from 1960s onwards. And these have given a tremendous improvement in the quality of life for patients with Parkinson's disease. However, we as a science, as a humanity, we always look for whether we can cure or we can also get what we call it as elixir of life, something which can give you a permanent life, amruta of the life. That's what we are looking for there. And there are various therapies, researchers are going on, which are trying to address these issues. We are slowly moving from symptomatic therapies to precision-based therapies. Because not all Parkinson's disease, even though they are all Parkinson's disease, they are all not the same. Because each of these Parkinson's disease patients develop Parkinson's disease because of various other their genetic disposition, what type of genetic mutations what they have, and how those genetic mutations cause the occurrence of Parkinson's disease. Because of these mutations, we have certain subset of patients being very sensitive to levodopa, leading to more dyskinesias. Some people develop early balance issues, gait issues, and henceforth there are so many other mutations are there which causes different type of issues in different subset of patients. Currently, we are going into pharmacogenomics. Pharmacogenomics means gene-based decision making. Of late, lot of work is going on. LARC2 mutations, what we call it, is one of the common mutations for Parkinson's disease. And we are looking into how these LARC2 mutations can be addressed. And people, those who are having LARC2 mutations, can they be having a better quality of life with specific pharmacogenomic-based therapies? There are quite a few drug trials have already started for this LARC2 mutations. Second, the other common mutation what is seen in Parkinson's disease patients is what we call it as GBA mutations. GBA mutations is very well known and they cause a certain different characteristic changes in the patients with Parkinson's disease. And GBA mutations can be treated well enough because some of the GBA mutations in childhood causes different type of what we call as metabolic disorders what people develop it. And currently drug trials have started for these GBA mutations. Further, we are also looking into different therapy modules and different approaches to see whether things can be made to have a better quality of life or how things can be made better. So in this aspect, there are a lot of things which are happening, which are trying to help to improve the outcomes of patients with Parkinson's disease. And down the time, we'll be going from what is this blanket symptomatic approach to each patient-based precision medicine-based approaches will come down. Let us say a patient comes to your clinic with Parkinson's disease patient, we test them. Like previous people everyone used to come with fever. We used to give a certain antibiotic only, whatever was there available to us in 1950s or 60s. Of late, then we know that if patient comes, you do a blood test, you have typhoid, you take this antibiotic, you have TB, you take this antibiotic, you have malaria, you take this antibiotic, right? Even though paracetamol remains the same for everyone, there are different approaches going to happen. And what we can see in next decade or so, there would be a bigger changes in the management of Parkinson's disease and pharmacogenomics will make a bigger strides into that.
Thank you. Dr. Prasad, would you like to add to that? And what is your message for World Parkinson's Awareness Day?
My message is that nobody should have any disease, but if a person does have a disease, Parkinson's disease is the only neurodegenerative disease which is treatable, and it should be treated. And we promise a good quality of life. The future is one of cure. But it's still in the future. But that's something to look forward to hope for the best for the future. Till then, we can offer them almost normal quality of life.
Right. On that positive note, thank you so much, Dr. Prasad and Dr. Prashant, for joining us here today on World Parkinson's Disease Awareness Day. We've discussed a lot. We have, largely the point remains that it is only 1/3 of patients end up on the negative side of it. 70% or more than majority of patients lead better and a healthy life as normal people. So on the awareness thing, we've got that straight out. Thank you so much once again for joining us here.
Thank you. Thanks a lot.
Thank you.